Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. South African President Cyril Ramaphosa warns wealthier nations against hoarding COVID-19 vaccines. Medical experts in Bauchi State apprise about dangers of low testing for coronavirus. And Britons throw their weight behind government's decision to establish hotel quarantines. But just before we tell you what's happening with the coronavirus at home and abroad, moments earlier today, there's been a major shake-up in the country's security circle as the president immediately ordered the appointment of new officers, new service chiefs. President Muhammadu Buhari, through his media advisor, announced their replacement and has also accepted their immediate resignation and retirement from service. This is the first time President Buhari is changing the guard since becoming the commander-in-chief in 2015. The new service chiefs are Major General Leo Irabo, who is the new Chief of Defence Staff. Major General Ibrahim Atairo takes over as the Chief of Army Staff. Rear Admiral A.Z. Gambo is the new Chief of Naval Staff, while Air Vice Marshal Oladayo Amao is appointed Chief of Air Staff. This is also coming after much agitation by some Nigerians for the change of the chiefs after the rising cases of insecurity in different parts of the country. So we start off immediately with more community recoveries from COVID-19, which have been recorded in Lagos and Kaduna State, with 435 and 184 discharges in the two states, respectively, and managed in line with the guidelines. On the same day, the country recorded 1,430 new cases confirmed by the Nigeria Center for Disease Control and 3 deaths, putting the total cases at 122,996, with 98,359 total recoveries and 1,507 deaths recorded in the 36 states and the Federal Capital Territory. In the meantime, Plateau State, now third worst hit state in the country, has a combined caseload of over 7,000 cases and 53 deaths after reporting 100 cases in 24 hours. Other new cases were reported from 17 states plus the FCT, with Lagos recording the highest, 744, Oyo State 77, the FCT alone 75 cases. Nasarawa recorded 74, Katsina 48, Edo recorded 42. You can see all the other states, they're recording 34 in Rivers. Ogun State recorded 33, Kaduna 26. Yobe recorded 10, Ekiti 5, and 1 case only was recorded in Gombe State. Now, this week, the number of coronavirus infections globally is expected to reach 100 million reported cases, even though just a year ago, fewer than 1,500 cases of the virus had been reported to the World Health Organization, including just 23 cases outside China. South African President Cyril Ramaphosa is concerned about the actions of wealthy nations who have bought up coronavirus vaccine to the disadvantage of poorer countries. Addressing the World Economic Forum online, Mr. Ramaphosa says such actions are condemnable as he appeals for release of surplus stock to Africa.
We need those who have hoarded the vaccines to release the vaccines so that other countries can have them. The rich countries of the world went out and acquired large doses of vaccines from the developers and manufacturers of these vaccines. And some countries have even gone beyond and acquired up to 4 times what their population needs. And that was aimed at hoarding these vaccines. And now this is being done to the exclusion of countries, of other countries in the world that most need this. We are all not safe if some countries are vaccinating their people and other countries are not vaccinating. We all must act together in combating coronavirus, because It affects all of us equally.
World Health Organization Country Representative Dr. Walter Kazadi joins us now on the program from Abuja via Zoom. We'd like to thank you for joining us on the program. And I'd like to begin with the comments from the South African president on what he described as hoarding of vaccine. Would you call it that? And perhaps the question also could be, do you see equity in vaccine distribution across the country, the world?
Thank you for having me on this program, and thank you for your question. What I would like to say, and as you know, from the start, the WHO was clear about the need to ensure that all those need the vaccine have access to vaccine. WHO has insisted on equity and the need for equitable distribution of vaccine as soon as they become available and endorsed to the whole world. So, and we were part of the COVAX facility, which was established as a mechanism to that, trying to secure vaccine for both self-financing countries and also low and middle-income countries. So we were anticipated to have a certain number of doses through that facility. Unfortunately, and like you said it, we are seeing some other development where the COVAX facility is kind of suffering some setback due to some countries, the self-financing countries, paying upfront for large quantities of those vaccine, leaving those non-financing countries, non-self-financing, with no choice but to wait.
But Dr. Kasadi, should Nigeria and Africa be worried about the supply fears? We know that, the EU is warning that producers must really deliver. And Nigeria is also expecting a batch as well, we understand, the end of January or in February. Should we also be worried?
Well, you know, it's anticipated that this year, the vaccine, the number of doses that could be made available through different mechanisms is 19 billion doses of vaccine for this year alone. And for now, the COVAX mechanism is secure just about 2 billion, a little bit more than 2 billion for this year. And that has to be distributed to many other countries, among many other countries, including Nigeria. It's anticipated that the vaccine will be made available progressively because right now there are very few that reach the advanced stage of the vaccine development. There's only one, as we speak, that has been approved under emergency use list by WHO, and there are others that are coming to enrich the portfolio quite soon. So in the coming days, weeks, or months, so we should see a better prospect for vaccine availability based on the rate of submission of the data to the WHO. And that in itself could also help ease some of the concern some countries are having, and Nigeria is one of them, of course.
I'd like to get your thoughts on the new B.1.1.7 variant and its implications. The Presidential Task Force talked about it being identified here in Nigeria, and also seeing that we are in the community stages and we also have insufficient testing that's ongoing. What's your take about its implications to how we're fighting the second wave here?
Yes, you know, as you know, the RNA vaccine, they mutate all the time. And one of the mutants that emerged was the B.1.1.7 in the UK and in South Africa with different type of mutation. As you said, the Presidential Task Force announced that that mutation has been detected in Nigeria. So what we need to do is to enhance surveillance, genomic surveillance and sequencing so that we know which strain is really circulating in the country. In the country where the B117 first emerged, now it's accounting for more of the positive cases being detected. So in Nigeria, we don't know yet what is, it's an explanation of the second wave we are seeing, although in the country where it has been documented, it was incriminated. So we need to do more research, NCDC working with the other research institutions to do more sequencing so that we can understand. But nevertheless, whether the B117 or another strain, the non-pharmaceutical measures, intervention still work. So we need to ensure that everybody continue to adhere to them. We continue to wear face masks in public. We practice social distancing, washing our hands or using hand sanitizer, coughing in elbow and other measures, avoiding overcrowded, confined environment, and many other measures. So we still have a window opportunity to control this surge. But while doing that, it's important to understand better where this surge is coming from. Of course, the explanation are multifactorial.
But if we comply with all of that, if we look at the compliance safety guidelines, do you think that if they're reasonably adhered to, and looking at the trajectory of the virus, and this, when can we say that the second wave will be over?
Well, that's the NCDC to respond, I'm assuming. But what I can say, if we apply those measures with the necessary enforcement, we should see the impact. I mean, they've been tested. It's possible that we could reverse the trend we are seeing now. But of course, we need to increase surveillance. We need to continue to find cases, to test more, so that we could isolate those that are infected and protect others from further infection. So for us to know that we've reached the peak, we'll continue to observe the number of cases we are seeing, new cases we are seeing every day. As you know, the community transmission has been established. We need more effort to curtail it. And for that, adherence to non-pharmaceutical intervention is key for all of us.
We appreciate your time on the program. Dr. Walter Kasadi, World Health Organization country representative. Thank you for joining us on the program.
You're welcome. Thank you.
And we go over to Bauchi State, where our correspondent Hajar Aliyu brings us this update on the challenge of reagents, which is impacting the state's testing capacity.
It's been 4 days now since Bauchi State recorded COVID-19 numbers. This is not to say that the state has defeated COVID, but because the state has not been carrying out testing due to shortage of reagents. This is coming at a time when the NCDC has asked states to scale up testing. The Commissioner for Health, Dr. Aliyu Megoro, has been speaking to us about this challenge and what the state is doing about it.
Currently, there is a program from the Ministry of Health through the Presidential Task Force for ramping up of testing in all the 36 states, including Abuja. So in Bauchi State, the committee came to Bauchi and we met and we have looked at our peculiarities in the state. So basically in Bauchi, we have done the training at the local government level where we can collect samples from each of the 20 local governments in Bauchi State. We have created the awareness in the community. So our major challenge in Bauchi is the testing. We need to buy this reagent, the extraction kits. In Bauchi, we have 2 laboratories, one at the specialist hospital and the other one at the teaching hospital at Abubakar Tafawa Balewa University. So these 2 laboratories, initially, they were commissioned to do automated testing, meaning that we have to buy the automated reagent that will suit the machines. And they are very expensive. And even at the NCDC, they are not forthcoming. So we are directed by the NCDC to combat to manual extraction. So the teaching hospital, through the support from the federal government, they were able to bought the equipment for the manual testing, while at the state level, we were able to bought the equipment with the support from the NCDC. So we bought the biosafety cabinet, while the NCDC supported us with the refrigerated centrifuge. So with these two equipment, we can be able to do the manual testing.
There are 40 active cases of COVID-19 in Bauchi State as we speak, and all these patients are not in isolation centers. They are receiving home care management. Health officials tell us that they are being treated at home in line with NCDC protocols, and only severe cases are taken to the intensive care units. And as we speak, there's no severe case of COVID-19 in Bauchi State. From Bauchi, Hajera Aliyu for COVID-19 updates.
Looking at the virus trajectory in Bauchi State, Dr. Hassan Garba is a public health physician. He joins us from Bauchi. Thank you for joining us on the program. I'd like to begin by asking, how significant can 4 days of no testing be?
Actually, it's quite significant in any environment for that matter, not just in Bauchi, because that means you've created a window where people are not tested, so you will not be able to know whether the infection is coming down, the infectivity is going up or not. And therefore, at the end of the day, since we're in a Harmattan season, Bauchi State in particular, we're in the north, far north so-called, the atmosphere is dry, it's cold, it's windy, and we have concurrent respiratory tract infections all over the place. So you have to do the testing for you to be able to discern whether it is COVID-19 or not, or otherwise, even tuberculosis or not, otherwise.
If we were to analyze how many people would one person with COVID-19 infect on the average in Bauchi State, or as you would say, what is the R at the moment?
Well, the occurrence now, as of the last 4 days, has been reading 0. But we know for a fact it's because the test is not being done in the last 4 days. Hopefully, maybe by tomorrow it will pick up. We're not too sure. When it will, if I come back, when we continue testing, whenever we are not too sure about that yet. But if we are going to be sure of what we are doing in Bauchi State, most probably we have to liaise with neighboring states. And if Gombe, for instance, only has 1 as of yesterday, while Plateau, our other immediate neighbor on the other side, has about 100, with quite a lot of lives lost. So I think it is time we really do some serious collaboration here. If our own kits are down, or capacity to test is down, it can be expected once in a while. It's not a hard and fast rule that everything must work speak and span all the time, especially since it is something new. But despite the fact that we have two extremely good laboratories, the reagents have to be there. Personnel are able and willing, and they are there. So why can't we collaborate with Plateau State and Gombe State to continue? Because if I remember very vividly for that matter, a few months ago, both Plateau and Gombe were dependent on Bauchi to get their own problem solved. And at the end of the day, the laboratories were really, really overwhelmed with tests to do from Plateau and Bauchi. And and Gombe, and if I didn't forget, there was even a third state that was coming to Bauchi also. I can't remember which state. But I think we should stop looking at this nationally or otherwise as a state alone thing when you have this problem. We should be running to each other's help. Just like my predecessor, the speaker, was speaking about collaboration between countries. It is not a question of who has, it's a question of who also doesn't have. Because like fire, it's a raging fire. If Plateau has it, Bauchi was not helping it that time. I assure you, the statistics from Plateau State would have been a disaster. But because Bauchi was there for Plateau, the area around Toro, when you're coming in from Jos into Bauchi, the temperature starts to drop from around Jos when you're coming to Bauchi. People were trooping to Bauchi from Plateau, getting tested and getting treatment at the same time. So the figure in Bauchi that time was looking very high. And nobody was asking Bauchi, how are you doing it? But unfortunately now, Bauchi has been overwhelmed, and I'm very, very sure it's a scientific thing, that it's a domino effect. It's a cascading thing. When the place was overwhelmed some months ago, those things were not replaced. Bauchi has been battling literally on its own with very, very little amount of funds available to itself. And not much in the civil service, but one is aware of what goes on out there, all part and parcel of it. The funding is not just coming, but they've been doing everything possible to make it work. So if Bauchi has a problem, the sister states, neighboring states who have their issues solved, should be, or rather their own problems have been solved, they should carry Bauchi along. And I think Bauchi should even take the first step to ask for help from these people to help us so that we can keep our data and keep our statistics. And I'm very sure at the end of the day, it will not be impossible to reach 0,000. But there may be a few missing ones here and there because the testing is not done.
As a health worker, what are some of the challenges you would say yourself and your other colleagues are facing as the country battles the second wave?
It's a very serious matter. The very first one, unfortunately, very unfortunately, is mis- and disinformation. COVID-19, one has said over another medium, not yours, about a year ago when it was really novel COVID-19, that in our environment, the atmosphere during this kind of season is not too good for the respiratory tract. It's not very palatable. So therefore, apart from the coronavirus, we have a lot of other rhinoviruses that are invading our respiratory systems. So people will easily mistake and misdiagnose the coronavirus. Now, because other than that, before the coronavirus even came up, we already had an issue with harmattan, dusty, dry, windy atmosphere. People are already wearing their masks. It is only the coughing and the hand washing issue that now became a little bit new. But we were already doing a lot of that. Now it has been enhanced. But the problems we're now facing is all the controversies and the conspiracy theories surrounding COVID-19 itself. Unfortunately, the vaccine has not landed, but is not going to hit the ground running, unfortunately. A lot of people are thinking that there are a lot of other things too to do with the vaccination, which we know most probably is not true. This is science. The 5G thing has been debunked already by our own Nigerian scientists. Physicists have come to tell us, no, it has nothing to do with the viruses. Some Westerners are telling us, no, it's not true. They know better. So I think if we can have Jojo, people should sit down, talk, and come out with one truth. And through the media, which is the main source of information for everybody, let us accept the fact that we need these vaccines before they even get here. And we need a lot of it. Because in the United States, when they're going to distribute vaccines, they are going to look for vulnerable populations. So almost everybody that is not a Caucasian and that is not elderly and that is elderly is, going to be vaccinated more or less. In our environment, it's not like that. But we are blessed with an environment that changes very fast, temperature-wise too. And the heat, I believe, it is what is helping Africa as a whole, not just Nigeria. Otherwise, we would have been dealing with a different story.
All right, we'd like to appreciate your time. Thank you so much, Dr. Hassan Garba, public health physician. Thank you for joining us and stay safe. Now, the number of people who have died from the coronavirus in the United Kingdom has exceeded 100,000. That's according to data from the UK's national statistics, which shows that there have been nearly 104,000 deaths since the pandemic began. Here's more on this and other stories in our global COVID-19 update.
Several Londoners threw their support on Tuesday behind a potential plan for the UK to introduce mandatory quarantine in hotels for some or all arrivals.
I think it's probably necessary, as long as it's not a gimmick, as long as there's some substantial evidence behind it, then absolutely that's anything we can do to prevent the spread of the infection, then needs must.
Ambulances carrying COVID-19 patients arrived at Santa Maria Hospital in Lisbon on Tuesday as soaring infection rates at the virus are overwhelming Portuguese hospitals. The health ministry says demand for emergency services has spiked, putting great pressure on response capacity, and Portuguese hospitals have said they are running out of beds. In the Netherlands, police arrested at least 70 people after rioting broke out for a third night after weekend protests that were initially linked to dissent over a government decision to implement a nighttime curfew. But the motivation behind vandalism and other incidents in cities ranging from Rotterdam and Amsterdam to smaller centers of Haarlem, Gelin and Den Bosch was no longer clear, with rioters overwhelmingly in their teens. Prime Minister Mark Rutte had earlier on Monday condemned the riots over the weekend in which anti-lockdown demonstrators attacked police and set fires. All this come as global confirmed cases of COVID-19 neared the 100 million mark on Tuesday, with over 99.5 million people reported to be infected by the virus.
Don't forget to protect yourself with, of course, the safety protocols. And also don't forget to stay away from people with no face masks. Although there's evidence that younger people are at lower risk to COVID-19, low risk doesn't mean no risk. Continue to take responsibility. Our website, channelstv.com, has more updates, also a better understanding of the pandemic. You can see some of the latest stories in politics, sports, business, all at your fingertips. That's the program. Thank you for watching. I'm Millicent Walker.